Ebola is one of the deadliest viruses known to man. It's named after a small river in the Democratic Republic of Congo where it first emerged in 1976. Up to 90% of infected individuals die from the virus. The African fruit bat is considered a natural carrier of the infection. Gorillas, chimps, monkeys, antelope and porcupines are also susceptible to catching and spreading the disease. There are several strains of Ebola: Zaire, Sudan, Bundibunjo, Reston and Thai forest. They're spread through contact with the blood, body fluids and tissues of an infected person. Researchers say airborne transmission may also be possible. After an incubation period of between 2 and 21 days, symptoms include severe fever, weakness, muscle pain, headaches, and a sore throat. This generally develops into vomiting, diarrhea, rash, impaired kidney and liver function, and sometimes internal and external bleeding to death. The Ebola virus multiplies quickly, overwhelming the immune system to fight the infection. No medicine or vaccine currently exists.
Ebola outbreak kills 60 in Guinea. Experts have been unable to track down the origin of an Ebola virus outbreak in the Western African nation of Guinea, first observed late last month. The Ebola virus is transmitted through bodily fluids, via oral and nasal exposure, and through the conjunctiva. The virus infects and replicates in immune cells, which further disseminate the virus throughout the circulation. Lymphocyte depletion and necrosis are observed in the spleen, thymus and the liver. Intensified immune response leads to dysregulated coagulation, which causes bleeding and hemorrhaging in the gastrointestinal tract. Compromised vascular endothelial cells also cause blood vessel leakage, leading to hypertension. Dysregulated host immune response, coagulation abnormalities, and impaired vascular system lead to shock and systemic organ failure. Typical symptoms of infection include fever, diarrhea, and vomiting, while some patients experience rashes and extensive internal and external bleeding. At least
The Ebola virus infection is systemic, meaning that it attacks every organ and tissue of the human body except the bones and skeletal muscles. Ebola HF is marked by blood clotting and hemorrhaging. Although it is not known exactly how the virus particles attack cells, it is postulated that one factor that allows them to do so is that they release proteins that dampen down the immune system response. The Ebola virus attacks connective tissue, multiplying rapidly in collagen. Collagen is the tissue that helps to keep the organs in place.
Measures to make sure that these viruses do not get into the country. But what exactly are we dealing with, and what is the Marburg virus? Well, we've heard a lot about Ebola, but what is the Marburg virus? Let's take a look at this right now. Now, this is a hemorrhagic fever very similar to Ebola, which does both diseases do cause virtually the same symptoms. So it would be very difficult to know if someone had, these patients had been visiting Kitoum Cave at Mount Elgon National Park. So that is very interesting, and of course the theories presented that some of those bat caves are where these patients were exposed to the virus. Now, the closest since the 1980s has been the cases in Uganda, and there have been quite a few of those between 2007 and 2014 rather. 22 people have died of the Marburg virus. The September last month's case was actually the most recent, and that patient did die. But since then, Uganda has said it is Marburg virus free, since no new cases have been presented in 2 weeks. So that's, in a nutshell, what the Marburg virus is.